Thank you so much. Thank you, everyone. You're most welcome to our today's meeting. We're going to start the meeting with the order of fellowship. The order of fellowship is the Rotary Grace will be said by me, Rukian. The Loyalties will be said by Jamal, the RCC member. We have also the forward test will be said by Maka Juma, the RCC member also. Then the final toast will be said by Chaniru Emil, Director Membership. We have the object of Rotary will be said by the team leader, that is Innocent. Thank you so much. We are going to stand up for the order of fellowship. The order of fellowship is going to be said by me, as I said, for what we have received and what we are about to receive, may we be truly thankful and ever mindful of the needs of the less privileged. Amen. Amen. We're going to the loyal toast to be said by Jamal.
I'm the one taking you through on the loyal toast. To His Excellency, the President of the Republic of Uganda.
To His Excellency, the President of the Republic of Uganda.
I'm going to say the forward test of things we think, say, or do. First, is it the truth? Second, is it fair to all concerned? Third, will it build goodwill and better friendship? Fourth, will it be beneficial to all concerned?
Thank you so much. Next, we are going to have object of Rotary.
The object of Rotary will be said by Innocent. The object of Rotary is to encourage and foster the ideal of service as the basis of worth enterprise, and in particular to encourage and foster first the development of acquaintance as an opportunity to service. Second, high ethical standards in business and professions, the recognition of the worthiness of all useful occupation as an opportunity to serve society. Third, the application of the ideal of service in each Rotarian's personal, business, and community life. Fourth, the development of international understanding, goodwill, and peace through world fellowship of business and professional persons united in the ideal of service. Thank you.
Thank you, everyone. Take our seats. Once again, I thank everyone for turning up for the meeting. Also, I thank those ones who are in the Zoom. I also thank people so much, and you're most welcome to today's meeting. We are going to have action points of last week's meeting. Then after the action points, we shall have updates from Achiba, team leader. Then after the updates from Achiba, team leader, we shall also have update from the team leader, that's Innocent, about Ramanda. Those are the major things we're going to discuss on today. Thank you.
Thank you very much. My name is still Jamal, taking you through on the action points of previous meeting actually. One of the action points was to signing agreement with the new community, which is the Ramada village. The second one is AG, the assistant governor, visiting Yumbe by this week, which was supposed to be by this week, sending data to Emmy about the mosquito nets so that can be able to feed the Ministry of Health on the number of mosquito nets that are needed by the villages of Yumbe. Second last, of course, was to liaise with the DHO's office. There was a need to liaise with the DHO's office or the malaria focal person to come up with a number of mosquito nets or the beneficiaries of villages of Achiba, Udropi, Ramadha, all Vesele women group members and the Rotarians. Lastly, of course, was the need to incorporate the idea of youth working together with the women in the savings that may also benefit the scale program. Thank you so much.
Thank you so much, the Secretary, for presenting to us the action points of last week's meeting. I think next is going to be update from Achiba. Then after the updates from Achiba, then we shall react on. After the update from Achiba, we shall have also update from the team leader. Then after that, we shall now react to what has come out of the two. We have Otile Yazid.
Thank you very much. My name is called Otile Yazid, the RCC team leader in Achiba. I have some reports which I'm going to give. The report from Achiba Community Youth Livelihood Program, operating savings, but due to insufficient capital, as tumbling blocked for these days. Secondly, B, Achiba community wanted to know how long will the organization supply with the malaria drug. C, finally, community members in Achiba have sent their greetings to the Chris and other Rotarians, and their welcome more of the projects. Thank you very much.
Thank you. That was a brief report from the RCC team leader of Achiba. Next, we shall have from the team leader, that's Innocent. Yumbe, also the executive director for SEDU.
Yes, thank you. Thank you so much, President, for giving me this opportunity. And indeed, today I don't have much to present because Ramada, which is the second village after Achiba, we have not actually started the project, and of course we have been following the criteria that is now carrying out the survey which we did. I think it is coming to almost 2 weeks that we analyzed the results of Ramada village, which requires us indeed to respond to their rescue. And today I'm not going to talk much about Ramada village because we have not yet started the project. What I can say is now I've just shared with the president to appoint a day so that we can reach to the community of Ramada, and then we sign an agreement. So she just told me that the agreement will be signed on Friday. Yes, on Friday. So when we sign the agreement with the communities of Ramada, where we agree what will they contribute, as we had already agreed that the communities have to also contribute, especially when it comes to latrine construction. They will have to contribute sand, they will have to contribute bricks. Of course, we already have the Makiga machines. They will need only to train the youth. And since Achiba communities are neighbor to them, they are already trained youth in Achiba. That will also, we shall unite them together. The youth which we have already trained will also, they become TOTs and train the youth in Ramada. Hopefully the first project, that is a construction of latrine, will start But earlier on, we had agreed that instead for us to start with the latrine construction, since we have already the filters which are here, then immediately after signing agreement, we shall need to distribute the filters to help the communities of Ramadhan. After we have distributed, and then we can go to the next project, that is latrine construction. As we shall be signing agreement with them on Friday, and we shall also ask them to start digging the pits, because at times the latrine construction will be delayed by digging the pits. But since we had come up with another resolution, that is making plate covers, because previously we learned a lesson from Achiba, where they had a problem of poles. Then later we come up with making plate covers, which made the work simpler and easier. So I think now I'm very sure by starting the project of latrine construction, it will not take us longer. So that is a brief update from Ramadhan community, Ramadhan village. Thank you so much for listening.
Thank you. Thank you so much, Innocent. Yeah, I can see Maggie is on. Maggie, you're most welcome to our meetings today, the AG. We're grateful to see you online. Thank you. And the next update, we are supposed to have our AG. She's called Maggie, and the Arua team to visit us today. But I think due to other circumstances, they cannot make it today. They'll still reschedule a day to visit us. Yeah, that was update from the two team leaders. Then we shall now, reactions are now welcomed, like the use of Achiba wanted livelihood. So I would like to know from the team leader of Achiba, for how long has the youth been saving and how much have they saved? For how long has the project lasted? And what is the name of the savings group for the youths in Achiba? So that's what I wanted to know from any of the representatives from Achiba. Thank you.
Thank you very much. By name is called Cheregarasidi, RCC member from Achiba. Last time I had been met the youths in Achiba for this program of livelihood. I wanted to know from them how much they have saved and how long. From them, they told me they had been saving money from January up to July, and they have already distributed it. But due to inadequate capital of doing the business to get the money for saving, they have stopped it for about 2 months. But they have told me if there is any other support, they will revive it and continue saving the money. The group name was Achiba Youth United Group, the one they used to save. Thank you very much.
Yeah, thank you so much, RCC Achiba. I think that is great that you have at least briefed us about the youth coming up to initiate. Maybe previously they dropped. Now this time they need to come up. Only my advice to you is encourage those youth to start saving. So when they continue saving, and then from there we shall know their commitment, how much do they save per week. Like I can see the other side of South where the borehole is drilled. I saw the women groups, those are VSLA groups, they do also saving every week. And indeed, they are saving every week. And also the interest, and they also contribute maybe in case of the breakdown of the borehole, they also can contribute on that. So I think that is a good example. If they had dropped, then this time let them come up, let them start saving seriously every week, and then you'll be updating us as we are attending these Rotary meetings every week, how much they have saved this week, next week, something like that. And then we shall evaluate and see how this youth can be helped. Since they are useful in that village, they have really helped a lot in the project of latrine construction. That's my contribution. Thank you.
Thank you so much, Innocent. I think when it comes to savings, once you distribute money among yourselves, the saving aspect has to continue. Like once the season comes, like if it's for 6 months, after 6 months, you're supposed, as soon as you divide that money among yourselves, then you continue with the saving aspect. I think savings are supposed to be continuous thing. And secondly, the youths, I will feel that next time we can lay them the machiga machines. If they still don't have something to do on, they can lay them as bricks and also sell the bricks. The little money they have, they can even, in fact, that they buy a cement, they sell the bricks, then the money also comes in their account. I think that way can at least help them to do something better. Instead of waiting for us to give them microloans. Microloans comes after, like, if you have saved for so many times, you have saved, you already know your source very well, and so is doing so ABCD. I think there it will become very easy. Nobody will cheat somebody. Yeah. To the youths, you can tell them, let them continue, as said by the Innocent. Then also they can as well lay bricks. Bricks, there's money coupled with our bricks laid by the machiga machines. They are so marketable. And I think it's only Yumbe which has the machiga. Our club has the machiga machines. Your place is at the roadside. You lay the bricks, you put them at the roadside. That's already market, and that's already something. That's already money. That is to me. And the youths, also the Achiba community, wanted to know from the Rotarians who are online and also the Rotarians who are in the house, for how long the malaria drug or the malaria is going to last. Not so. Yeah. So I think Innocent can talk on that.
I think that is a good question. About the malaria, how long it will last in Achiba. As we had procured anti-malarial drugs, including RDTs, to support the communities of Achiba. And that's why we are coming up, how can communities of Achiba sustain this project? But still we have the drugs. We are still left about 3 boxes of anti-malarial drugs. Once these anti-malarial drugs get over, how are you going to continue? That's why we continue having these meetings for sustainability of those drugs. For example, if you'd come up with your savings, like the youth could come up with the savings, and then you lend up this money, and then this person repay it with an interest, such an interest can be saved. Yeah, such an interest can be saved. And I can also see some other women also, they have already initiated the VSLA groups in Achiba. So such a women groups, they continue saving, and then the interests they earn, they can keep on contributing. Youth contribute, and then other VSLAs who are already on ground can also contribute. And then you can continue buying RDTs and then and buying the drugs. At the same time, we shall liaise also with the district team who could provide us with RDTs. I think that is a way how you can continue having those anti-malarial drugs once the ones we have gets over. That is what I can add. Thank you.
Thank you so much. Yeah.
Yeah, I'd like to add something. I totally agree with Innocent that the best way forward is to find a way that it's sustainable within Achiba, that their own savings, that they're saving money by not having to treat for malaria. And they're also, I think they're contributing to support the borehole. Maybe that pool of money could be used for buying medicine going forward. If we can find a way that we can make it sustainable in Achiba, that frees the Yumbe Rotary Club to use their resources to help other villages and eventually become sustainable too. I don't know, that's kind of jumbled. I hope I made that clear.
Yeah. Secondly, we also received the magazines, September magazines. We have them here and we have identified a school, a secondary school, to which we shall deliver some of the Rotary magazines to. We are yet to identify the secondary school after a year, and then from then we shall deliver the magazines, some of the magazines to the Rotary school, to a secondary school rather.
That is so good to hear. We're very
Okay.
excited. President Rukia, well, I guess she's no longer online. Rebecca Mukiibi was online, and she is the Rotary Peace Scholar, I believe that's the title, who is in Kampala again, but she says that she will visit Bidi next week, and inshallah, she will visit the Rotary Club in Yumbe. If you contact her, maybe she is more likely to visit you.
Wow.
Thank you.
Thank you so much. Then once we get her contact, then we shall invite her.
I think this is really a very good news to meet Rebecca physically here in Bidi, and we can take even her through the VSLA groups are based in Bidi Zone 1, and then Village 4 and Village 12 and Village 2. That will really be great lesson learned from those women groups. But could she share her emails with us, so that we keep on, we can continue coordinating each other? Maybe it's in Kampala this week, you can reach to Bidi this week, can meet the Rotarians of Yumbe, something like that. I think that would be great. Thank you.
Thank you so much. This is Lenny Christie. Concerning the magazine distribution to the schools, I also feel as we usually use the health center, that is the health center for collection of our data for Rotary activities. And we also collaborate with the district health office. It will also be nice if we could give them this copy too, so that they see exactly what happens with the Rotary Club of Yumbe. Thank you so much.
Very good ideas.
And if you could send us photos of people using those Rotary magazines, we can send in a little article to Rotary International about how you're spreading the word about Rotary throughout the Yumbe district. It's a great use of the magazine. I agree.
Yeah. Thank you so much. Once we deliver the magazines, then we shall be taking photos from there. Immediately we send them to you, to the rest.
Perfect.
Yeah, I think, yeah, that was updates from us. Next, now we shall go to reactions. Reactions are most welcomed. and any other updates from the Rotarians who are with us is most welcomed.
We are
Either online.
We are delighted, President Rukia and Rotarians of Yumbe, we are delighted to hear of your continued work and so proud of what a good job you're doing and what great service to the community of Yumbe that you provide. This is real leadership, servant leadership. Thank you.
Thank you so much.
Updating P2P bought 4 more boxes of filters, of water filters, of the Sawyer water filters, and shipped them from Liberia, and I don't know where they are, but they're being shipped from Liberia, where we bought them at a slightly reduced price. They're being shipped to MP Avaco, and sometime, I think, in the next week, those 4 boxes of filters will arrive. We spent about 15,500,000 Ugandan shillings to buy those filters so that you can help more communities. It will be 200 filters, which maybe could help as many as 7 communities. We shall see. You can decide how you proceed. So that is one point. The filters should be on their way to MP Avaco, and she should be receiving them anytime now. The other update is with the MPI. Thank you. Is with the MPI request for funding. That's Malaria Partners International. I have drafted a report for you, but responding to all of their questions. And for every question they raise, I have put a draft response, but the one thing I do not have is the current price for RDTs, for ACTs, and for long-lasting insecticide treated nets. So I have written and requested those prices. When I get them, I will send that draft report to you so you can put it online as an addendum to your application to MPI. Do you have any questions about any of that?
No, we don't have much questions on that. But I think Innocent first wants to say something on that. We actually thank you so much for supporting us. We thank P2P as a partner. We also thank TCB Global as a partner. We also thank Malaysia as a partner, and we also thank all the members who have been with us, who have been giving us much support to sit with us. We deliver good service to the community. We deliver what is to be done, and we fulfill the community needs. Thank you so much. I thank everyone for supporting us, for making us to work with our heads raised. I really thank you so much, the partners who have been partnering with us. Thank you.
Thank you.
Yeah, yes, I think my concern is still about the messages you sent, the quotations of RDTs and then antimalarial drugs and the mosquito nets. I think I previously procured RDTs and the mosquito nets, but it has taken some time back. I don't know whether the quotation still remains the same, but what I can't tell is the price of the insecticide mosquito nets. So if it would be okay to send you the quotations which I had previously, but currently I can't tell. I could also send you maybe if you would also think of the current price and we send you the quotation, and that will be really great. And another thing is, I don't know whether Dr. Brian is still in Uganda or based in Kampala there. There was a time I think he also procured the antimalarial drugs. So he could be, I think, the best person to help us with the price, the real current quotation of the prices of those mosquito nets and then antimalarial drugs and RDTs. So I don't know whether he's in Uganda or he has moved out outside Uganda. That's what I can't tell. But we shall try our best trying to find out the prices. I plan to reach to Arua maybe towards the end of this week and try to ask from the pharmacy how much do they sell, and then I will update you too. But if there's any other person who already know the quotation, can I think update you very fast. Thank you.
Thank you so much. As soon as you can get the current quotation, that is good. I have written to Dr. Brian. I have written to you. I have written to the national medical stores, but I have not received any quotations. So inshallah, we will hear quickly. And maybe our friend Gloria, who is now online, can get us the latest quotations for RDTs, ACT packets for children and adults, and long-lasting insecticide treated nets.
Okay.
That may be a request for Mother Rotarian Gloria.
Hello, good morning and good evening.
Good morning and good evening.
I'm sorry for joining late. I had joined at 3 o'clock. Then I'm writing a case study report and it should be submitted today. So I went into that document and I forgot that the meeting time has passed. Sorry.
It's okay. You're almost welcome.
Thank you. I'm glad to join you online, and I hope that the Yumbe Club can send quotations for the malaria, antimalarials, and mosquito nets. You can get them from joint medical stores. I think I don't know if they are there in Nebi, I mean in Yumbe, but they have a regional office in Arua.
Yeah.
It will be good to get. It would be good to get a quotation from them. I'm going to share with you a contact of the manager there, Ali Asiki, and you can talk to him on phone or on WhatsApp or even by email.
Okay.
Yes, we had a meeting with the Malaria Partners International on 28th of September, and they reported that the Yumbe application still waiting. It was not approved because they were still expecting more information. So I think I posted it on the WhatsApp for the Rotary Club of Yumbe. I think I posted that feedback from MPI there.
Yeah.
So I hope you can work on it. I also sent a message to Innocent to request that you please respond with Rukia to the queries raised by MPI so that they can consider funding the project.
Yeah. Yeah, another thing, Gloria, I would also like to know from you, you promised sending for us the other format for reporting.
I did send it. I sent it by email.
Okay.
Yeah, I did send it. It was a template which we drafted for the Rotary Club of Arua, Kuluva Hospital, and Malaria Partners Uganda. It was a template that VHTs were using. We extracted it from the register because whatever is in the register, it is going to go to the DHO's office. But if you have an extract and you bind it, I even explained it in that email that we made a spiral bounding of it so that every month the documents are kept in one book, and you can keep a copy for yourself as the Rotary Club of Yumbe. You can keep a copy for the other partners like SEDUC, whoever is collecting information on the ground. Because what is in the register will go to the DHO's office. But what you prepare for yourself, you will keep it for yourself as the Rotary Club or as SEDUC. So I shared that template. I don't know if you have not received. Did anyone receive it?
No, send it. I don't know, we shall check. If we never got it, then we shall still get back to you.
Let me even look in my emails and I see.
Okay.
Yeah.
All right, and for your information, I have attached to the chat, which you may not be able to see. I will send the draft response point by point to MPI's request for the addendum. So I only responded to the areas that they had questions, and this is just a draft response that you can use. What is lacking is still the prices and number of RDTs, ACTs, and long-lasting insecticide nets. Could we have Rebecca introduce herself again, just briefly, about her visit to Yumbe next week?
Yeah, she's most welcomed.
Good afternoon, everyone. Thank you, Chris. I joined your meeting a few weeks ago. My name is Rebecca Mukiibi. I am Ugandan American, and I was selected as one of this year's Rotary Peace Fellows at Makerere University. I am implementing a social initiative in Bidi Bidi refugee settlement. And I was there in August, and now I'm returning next week, and I'll be there for about 3 weeks for this current trip. And then hopefully, I'll return to the US and then come back again before or around early next year, 2023.
Okay. You're most welcome, and it's nice to see you for the second time again. And we shall be very grateful if you visit our place and also attend our meetings. And we shall also be grateful if you share your contacts with us, so that we'll be knowing that when you're coming, then we shall really look forward to meet you personally.
Thank you so much. I will absolutely reach out. Chris has added me to the WhatsApp group. I apologize. I've been very silent on the WhatsApp group. But once I reach Arua and Yumbe, I will let everyone know, so that way we can coordinate a time and a date that I can join either the meeting or some of the other events that are taking place.
Yes, I'll be grateful.
Thank you so much.
Thank you for thanking us, and thanks for your time. Any other reaction is most welcomed.
Rukia, I've just checked through my emails, and if you check an email from me on September 22nd, I copied to Chris, to Rukia, to Helen, and Innocent.
Okay.
And to Amy Mulamai. September 22nd, I was responding to the review of Charlie Dickey, and I gave options of what it would cost to do a mass drug administration, and I put my ideas there, and then I made 2 attachments of the monthly reports, which the VHPs have been writing, and also the template for the treatment.
Okay. I think we shall take that.
Yeah, if you check that email of September 22nd, you will find it. There were 2 attachments from me.
Okay, please.
Yeah.
Thank you so much.
Yeah, I'm glad to hear from Rebecca Mukiibi. She's welcome. It's good to know that there's a peace fellow who's going to Makerere.
Yeah.
Thank you, Miss Gloria.
Which club has sponsored you?
I was actually sponsored by the Brooklyn Bridge Club located in New York City, because that's where I've been living.
Yeah.
But I enjoyed spending time in Uganda and meeting all of the different Rotary clubs, as well as I attended the Houston annual convention, which, was, great exposure as a Peace Fellow. And I'm always interested in, visiting clubs and getting to know more Rotarians.
Okay. How did you get a Ugandan star name?
I was born in Uganda, but I am actually Rebecca Nansubuga. So I come from the Mamba clan. And when I was much younger, I was adopted by my uncle and aunt, and their surname is Mukiibi.
Ah. Okay.
Yes.
Oh, that is good to know. Thank you. All the best.
Thank you.
Yeah.
Thank you.
Okay.
Thank you so much, Rebecca, for knowing more about you.
My pleasure. Thank you.
You're welcome. Yeah. So another update from the Rotarians in the house or Rotarians online?
President Moses joined for a while, but it appears like he had other things that or lost the connection. So he gave us his greetings and then we lost the connection with him. Thank you.
I think you will now get the recordings. Yeah. I think if there's nothing more to be discussed, we shall have to close the meeting with the final toast.
Very good meeting. We are so proud of you. You are movers and leaders in Uganda and in Rotary. This is a moment, this is a thing of great pride to us to see how you make such a difference in the world. Thank you.
Thank you.
And through the Rotary magazine, we hope we can show your example to Rotary clubs in other places so that others can learn from what you're doing and see what's possible.
Yeah. Thank you so much.
Yes, I'm glad to see Helen. I was worried last week when I didn't see her. Good to see you online today, Helen.
Yes, nice to see you too. Yeah, I was AWOL. I was just having a fun week last week.
Where in California did you go to? You know, I studied from UC Davis in California.
Ah, so I started from San Jose and went south to San Diego.
Oh, okay. Okay.
Helene was dodging the hurricane.
Yes.
We're glad you're safe.
Yes, me too. I feel bad for the people on the west coast of Florida. It was devastating.
Yeah, it's too, the damage is so much.
Yes, so one last mention. You will practice your presentation to Rotary of Colorado WASH organization, WASH Action Group, after this meeting. If anyone wants to join us for that, I will sign off briefly and then sign back on to start a new recording to go through that rehearsal. Do you still plan to have that rehearsal after the meeting?
Yeah, that's why we're ending the meeting so that we can sign in.
All right, you can end it. Thank you.
So we are joining the meeting. I'm going to join the meeting with the final toast, which will be signed by Chandelo Emily, Director Membership.
By Emily, I give you Rotary International.
Rotary World Over. Thank you. I thank everyone for having coming to this meeting, and wish everyone very well. A nice day.
Thank you. Thank you.
Thank you.
And a nice evening, a nice morning.
You want to do the practice of your presentation now?
Those who are doing it could stay online.
Okay, please.
Is there, Chris, do you have enough time to run to the end of this meeting, or it will soon end?
I finally figured out how to do my paid meeting, so it doesn't end.
Okay.
Just for a couple of weeks, I didn't know what was happening, and paid meeting was switched to non-paid meeting. But paid meeting does 100 people for unlimited time.
Yeah, that's also what I subscribed to, and it's good. It's convenient.
Yeah, yeah,
yeah. So is Rukia and Innocent doing the presentation now? I wish they can do it now because I have another meeting.
I think it's three of us who will be presenting. Me, then Christine and Innocent.
Okay.
Yeah.
Let's see, and I will try to get up your presentation so that you can see it quickly.
So we first sign off, or we can still remain online?
Let's see. PowerPoint and hub report. I think that's it. That's it. So I need to get it. So you can see it. All right, here it is. When you're ready to, are you about ready to begin?
Chris, I was wondering where you got that map of Uganda from. It has the spellings which are not the current way of spelling the names of those countries.
Yes. Good point.
Yeah. For example, DR Congo is spelled with a C, not with a K.
And next you're going to think Kenya is spelled with a Y.
With a Y, not an I.
And Tanzania is spelled with a Z, not an S.
Not an S.
And Rwanda is spelled with a W, not a U.
Yeah, exactly.
You must be getting your spellings from elsewhere.
On the other hand, it's similar enough that people will know what they mean, and I think they'll recognize that there's maybe another language involved.
Yeah.
So I wouldn't really worry about that too much.
So tell me when you are ready and I will do the introduction to you.
That is so funny. That a mother has left her child in the meeting room.
So friends, are you ready?
Yes.
You're sitting next to each other so you can hand the phone to each other and speak directly into the microphone, yes?
Okay, thank you so much.
Hold on, and I will do an introduction and turn it over to you then, okay?
Okay.
Ladies and gentlemen, Rotarians of Colorado Wash, we are presenting the Partnership and Impact Report of Rotarians of Yumbe, Uganda, and the Rotarians who will be doing the report are Rotarian Lenny Christine, the Director of Public Relations for the club, Rotarian President Rukia Drisiru, and Rotarian Community Corps member and director of a collaborating organization, Ajaga Innocent. And with that, we turn over the presentation to the Rotary Club of Yumbe. Thank you.
Thank you so much. The first presenter is Lenny Christine, Rotarian from Yumbe. Yumbe Rotary Club, Uganda. The Rotary Club of Yumbe is the youngest Rotary in West Nile. The club was chartered on 7th April 2022. The now charter number is 224214. Now has 24 members, mainly women from saving groups who get their support from TCP Global, USA based. The club is located in Yumbe, and Yumbe is a hard to reach district in northern Uganda. The population of Yumbe is 5,890,500. And refugees also, Yumbe hosts actually the largest number of refugees, approximately 300,000 refugees in Yumbe district, making approximately total population of 900,000. Next. Area of intervention, Yumbe Rotary Club, intervention areas. We also provide hygiene and sanitation. We provide provision of clean water. We also eliminate malaria. Next. Background of Yumbe activities. We, the Rotary of Yumbe, believe in partnership to achieve our goals and make our communities healthy. Therefore, we partner with many organizations, both international, national, and local organizations, and also including other Rotary clubs. For example, our mother club in West Nile, in West Nile next to Yumbe, who has built our capacity, is Arua Rotary Club. And to mention some of the organizations that support us, this is a TCP Global that supports the saving group. P2P supports on WAS General, and Good Foundation International also supports us in training women on Rotarians on soap making and also making sanitary pads. And we also collaborate with government, our local government, both sections for health and WASH. Care, education, and child center development is our local indigenous organization that also supports us in providing our activities and also in coordination of our activities. All the mentioned organizations have made it easy and possible for us to achieve our objectives in mentioned villages. This is Dula village, Odropi village, and Achiwa village. Next. Our objective is to increase access to malaria prevention and care services among communities in Yumbe by the end of 2025. We also would like to increase access to clean water source in the communities of Yumbe by the end of 2025. We would like to improve sanitation and hygiene of the households in the communities of Yumbe by the end of 2025. Next. Hygiene and sanitation. Hygiene and sanitation, our activities that we do, the methodologies, we first advertise on radios. After making adverts on radios, then we encourage the chairman of the local communities to apply and send for us their applications. After sending for us the applications, then we short them, then come to conduct interviews for verification of the community that is really in need. You can see picture number 1 here, the Rotarians conducting interview for the community local chairman. Activity number 2, you can see it on the picture there. We build the capacity of the youth of the concerned community on local brick making that is using machiga machine, which is environmental friendly. Activity, the Rotary Club Yumbe has improved the hygiene and sanitation of the 3 villages in Yumbe district, that is Dula, Odropi, and Achiba. You can see the first picture here. This is the Rotarians together with the community members. They are doing hygiene and sanitation activity in the community. It's more of building the capacity of the community on how to handle their own environment. Activity number 2 is building the capacity of the youth in making cover plates, that plate covers that will be put on their latrines to make it more cleaner, to avoid infections. Impact, latrine coverage improved from 34 to 99%, 99%. Diarrhea reduced from 78 to 28%. Hand washing facilities increased from 10% to 99%, and clean source of water improved from 35% to 95%. Next. Thank you so much. The next presenter is going to take over. Thank you.
Thank you so much. I'm Rukia, the president of Rotary Club of Yumbe, taking you the next slides. We have provision of clean water. The methodology we use is to read the adverts, to select the best villages in the interview meetings, conducted an argument signed with the villagers. You can see in the picture number 1, the community members signing argument with the Rotarians. Another picture number 2 shows the community contribution towards the projects we are implementing in their villages in provision of bricks, sand, and also stones to see to either the project goes successfully. We have activity. Next is they're going to be about the activities. The Rotary Club Yumbe provides 1 deep borehole. As you can see, a heavy truck drilling a borehole in the first picture to the community. And also the second picture is shallow well drilled for the community members, as you can see in the picture number 2. Then picture number 3 is about distribution of the bucket filters to the villages. 4 wells in Dula village and 3 wells in Odropi village, and also the distribution of buckets in Achiba village. We go to the impact. 93% of safe water source reduced to 32%, 78% of waterborne diseases reduced to 35%, and 4 hours spent to fetch water reduced to 1 hour. You can see in the picture number 1, the community members jubilating a borehole being drilled for the first time in Achiba. They are very happy to drink safe water. Then picture number 2 shows how happy the woman is in pumping the water. Then picture number 3 shows how they can take water from the soya filters and the buckets. You can see. Next. Malaria elimination. We have the methodology, home visits on malaria prevention and care service. You can see how the Rotarians are sensitizing the community members, how the community members are attentive to attend to the Rotarians. Then picture number 2 shows how the Rotarians are having community dialogue with the communities on how to prevent malaria and how to have health talks with the community members. Then we have activity. Malaria elimination activity is done by the Rotarians of Yumbe in 3 villages, as I mentioned before. That's Odropi, Dula, Achiba, with the help from village health teams in Yumbe district and Yumbe district health focal person. As you can see in the picture number 1, district health officer training the village health team together with the Rotarians. Then picture number 2 shows home test and treat from homes. Then we go to the impact. The impact of 620, we go to the impact. The impact shows that 568 households have been reduced in the 3 villages. That is Odropi, Dula, and Atiba. As you can see in the pictures, the community members are for test and treat. The picture number 1 shows that. Then picture number 2, the same also about the test and treat. They are now treating. Next. Challenges encountered. We have transport for field visit is limited. Resources for the programs are not enough for expansion. Many villages are seeking for support to implement the program in their areas. Mosquito nets are torn and lacking in many households. Next. We go to the lessons learned. Increased rate of planting mosquito repellent plants around households in the beneficiary villages can reduce the spread of malaria. We plant mosquito repellent which are effective, 99% effective, which do not attract mosquitoes. Establish approach to listen to audio messages on malaria prevention, through motorcycle talk by the community members, growing appreciation and focus by the communities on sanitation, hygiene, safe water use, community-led projects and involvement of international volunteers, district local government, and local actors in project implementation have a great impact. Thank you so much. I welcome the 3rd presenter.
Thank you so much. Call me Innocent Ajaga. I'm the Executive Director, SEDOC Child Development, that partners with Yumbe Rotary Club. And at the same time, I'm also a team leader of Rotary Community Corps that works together with the Rotary Club of Yumbe. I'm going to take you through our achievements, our result obtained. As you have seen on the bar graph on your right side, it shows the impact achieved by the Rotarians through partnership. When look at malaria prevalence in Odropi, these are the villages where we implemented the activities successfully. So when you look at malaria prevalence in Odropi, it dropped from 75% to 25%. Sanitation and hygiene increased from 40% to 98%, and clean water sources increased from 35% to 95%. Dula malaria prevalence dropped from 74% to 34%. Sanitation and hygiene increased from 28% to 48%. And clean water source increased from 28% to 97%. Lastly, Achiba malaria prevalence dropped from 68% to 20%. Sanitation and hygiene increased from 38% to 98%. And clean water sources increased from 40% to 99%, as shown on the bar graph. Next. Recommendation for performance improvement. New mosquito nets need to be given out to the households who do not have mosquito nets. 2, resource mobilization needs to be in place to expand our programs even to cover other districts in West Nile. Village health village health teams need to be facilitated to implement the activities since they are our front key implementers. So they need to be facilitated for the successful of our projects more. Fourth, transport facilitation need to be fixed for the program volunteers who work together with the Rotarians in Yumbe. Next, strategies for the next activities. 1, evaluation, research, and surveillance. 2, capacity building. 3, resource mobilization. 4, sustainability. Next, appeal. Rotary Club Yumbe hereby appeal to other clubs, philanthropic individuals, charity foundations, Rotarian volunteers to enhance and expand the activity impact undertaken by Rotarians of Yumbe in the communities through any kind of support can reach us on email yumberotary@gmail.com or Yumbe Rotary President at email disirurukia40@gmail.com or to Yumbe RCC team leader at email innocent074@gmail.com. That marks the end of our presentation. I therefore welcome all the Rotarians who have attended our presentation, international NGO representatives, well-wishers for any suggestion and questions. Thank you.
Yeah, perhaps you covered this and I missed it, but someone might ask, how much does it cost to do all these interventions in one village? So they know what they could donate to.
Okay, I think that is a good point to note. That means we shall need to have that in our mind to know, yes, the budget, because we are already having the budget for Dula village and then Achiba village, how much we have so far invested, even in Odropia, how much we have so far invested. I think that is a good point. Thank you.
Because I think the way you do it is very affordable. And I think people would be more inclined to support your efforts if they knew just how cheap it is to make all these amazing changes.
Yeah, yeah. So could you tell us, because what we are after right now is maybe some guidelines, maybe you can give how to present, and then mostly we rely on the time. So we need to know this time, how much time have we used in all, or maybe how much Disiru has used, Rukia has used, Lenny Christine has used, and then Innocent has used. It will help us also to adjust accordingly, because we need much of our time we need to give to the audience.
Okay, the amounts of time are, Lenny Christine took 7 minutes. So that was a slight increase from her last time. Rukia took another 5 minutes and 30 seconds. And she finished at 12 minutes and 30 seconds. And Innocent finished at about 16 minutes and 40 seconds. So that was another 4 minutes and 10 seconds. You're still between 15 and 20 minutes. So if you do not increase time much, then you're still within their time, acceptable amount of time. They say 15 to 20 minutes for presentation, and then another 10 minutes they will ask questions. They may not start asking questions right at the end of your presentation. They may hold off for a few minutes and then ask you questions. I don't know how they will do that. So Lynn
Okay.
and Christine, 7 minutes, Rukia, 5 minutes, 30 seconds, Innocent, 4 minutes, 10 seconds. From our friends online, are there any suggestions how to make the presentation better or any reactions to it? Rebecca, you have just heard this story for the first time. Did you understand what they're doing?
Yes, it made a lot of sense. I think it's great that they've separated the different sections between the three of them. My only recommendations would be that maybe in some of the earlier slides that have a lot of data and numbers, to maybe cut down on the words and leave only the information that they find most important or they want the audience to leave away taking, whether it's the number of, the population, just like key numbers. They can keep most of those notes for themselves if they're going to be reading off of note cards. But for the most part, limit the number of words on the slides. Then for the last slide, when the appeal to the audience and the other groups, I would maybe suggest, if it's possible between now and the presentation, if they can maybe create a GoFundMe or another link where the audience can click on, and this would go back to what Helen was talking about, where there's already a breakdown of the budget, what they have been able, the resources that they've been able to accumulate and how much it costs and what else they need. I would also maybe recommend that someone, one of the presenters, puts the email addresses of the 3 contact individuals in the group chat. So that way, if the audience is unable to read the email addresses directly from the slides, they can just look in the chat and they can get that information from there. I hope that helps. But overall, I think it's a great presentation.
Great. Thank you so much. Go ahead.
Yeah, the only thing I would add to that is that since this presentation is coming from Yumbe and there's the possibility that the connection might not be great, I agree that usually you want to have as little writing on the slides as possible. But in this instance, you want to also reduce the writing, but make it so that people will still get all of the information and the background in case the connection is poor, which often happens.
All right, and to respond to that, my understanding is the whole slide presentation will be distributed to all the participants. So they will be able to download the slide presentation as well as hear and see it. Gloria, did you have any suggestions, advice, reactions?
I think both Rebecca and Helen have pointed out the things which are outstanding, but what stuck to me most was on slide number 2. I think it was crowded, and Christine spent a lot of time actually on slide number 2. And most of the things she said are not on the slide. Another one was also in reference to the photographs. As they're doing the presentation, they are mentioning that photograph number 1 and number 2. So, but it was not rhyming with what we're seeing. So that was another thing. Was this slide number? No, there's not that one. There's another slide. Yeah. Chris, maybe number one. One, yeah. Also, the population, it's not 5,000. It's actually 589,500.
Yeah, it is true.
Yes.
That mistake was realized.
Yes, and Chris, please go down through another slide. Also, I did communication when we were talking about, that's slide number 3. I think it has a lot of information which maybe could also be reduced. I don't know if it's too much to read, but as the presentation is done, it will be good to maybe paraphrase them and reduce it to what can be listened. Otherwise, when you expand on what is already there, it takes much more time.
Okay.
Yes, if trying to summarize, tell me if I'm wrong. When you present a slide, you can say in fewer words what is on the slide. And only say the very important things. So you might say our method is we do radio advertisements in the neediest area. The communities have to respond. We visit the communities, et cetera, et cetera. So the information on the slide, eventually the people can read the slide, but when you talk, just talk about what's on the slide. You don't need to read it all. So for instance, on the big impact slide, which one is it? So on this one, you might say, as you can see, in all 3 communities, we almost achieved 100% water coverage. We generally reduced the incidence of malaria by 75%. And generally, we increased sanitation coverage to almost 100%, except in one village, and we had to change our method because we learned not to do water before sanitation. And that generally says what's on that slide.
Yeah.
So your presentation is good. It will work as you have it. But if you can simplify rather than saying everything, so that people will be able to fit in their minds what you're saying. If you give them all the information, then it's too much for them to absorb. So for instance, this first slide, as you can see on our map, our district is in the far northwest of Uganda, right on the border of South Sudan. We have about 600,000 Ugandans in our district. We have about half that number of refugees from South Sudan. In our club, which is a new club, is that where this is? I don't remember where it is. We partner with other organizations. The other organizations are TCP Global, an international microloans organization, P2P Incorporated, which works with us in WASH and malaria. Good Foundations, which works, so on. So although more than that information is here, you're summarizing it, I believe, as Rebecca was suggesting. Does that work as a summary for you, Rebecca?
Yes, it does. It does. I think the way you've articulated it, Helen has articulated it, and RC Gloria has articulated it, you know, I think that makes a lot of sense. I also wanted to also point out that, you know, the presenters should also make sure the information they're providing is up to date. For example, the current population of refugees in Bidi, if it's, you know, what's noted on maybe on the UNHCR data online, to make sure that it's 300,000 refugees, for instance. Recently I heard that Adjumani refugee settlement is now the largest refugee camp in Uganda. And I also would like them to check to see whether Bidi is still considered the second largest refugee camp in the world, or the third largest, because I believe it's now the third largest. So just for them to follow up on that information, so that whether they're providing the audience the correct data.
All right, and if you get that data, if you get the ranking, that will be great. The other way of doing it is saying we have among the largest refugee camps in the world in our district.
Among the largest, yeah.
So that doesn't say the largest, it doesn't say the second, the third, you just say among the largest. And then that will cover all possibilities.
Okay.
Good.
Yeah. Indeed.
Anything else before we end this?
Yeah, I think it's just our thanks to you for guiding us, and we are trying to catch up what you have just told us. We are going to summarize them directly to the point, and especially what Gloria pointed out about reading the figures. So it means we need to be very careful and read the figure, which is exactly written on the slide. So that way it will also be perfect. Thank you so much for all your guidelines. Still, we shall continue practicing that until the day comes on Saturday in the evening. And as Helen has spotted it, you know, right now we are using the slides from our computer, but unfortunately our inverter got blown by thunderstorm. So we got an inverter that comes on and goes off. So we are trying to find a way how we can fix that, because we are reading our slides from the computer as we hold the smartphone. Because on smartphone, we can't see it well, but when in our computer here, as we see, and it looks much better. So those are some of the challenges we might be also incurring on that very day, but we are trying our best to see that nothing should really stop us presenting due to power problem.
Go ahead, Gloria.
Innocent, one of the ways you can avoid any mishap on that day, it may be good to print out those slides and you use them. So you are going to read from a printed out slide, which will be on a piece of paper. That's normally what I do to avoid, when you're doing a presentation, you must always prepare for eventualities. So I'll advise that since I think there are 15 slides or 11, so suggest that you print out those slides, 1 page per slide, and you distribute them among yourselves, Christine, Rukia, and Innocent. So each one holds the paper that they're going to read on. And that way it will also help you to be focused and to look into the camera when you're doing the presentation. Otherwise, when you're doing the presentation, we're only seeing your backside. And yet it's a good idea to look straight into the camera when you're doing a presentation.
Yeah. Good point. Noted. Thank you. Thank you, Gloria. Okay.
Anything else?
Yeah, if I can do it. I'm trying to post a possible change in how that one slide is presented. But I think I'll have to send it to you by email because I can't post it in chat.
Okay. Yeah.
So to summarize, you have an excellent presentation. You're doing very well. We're making small suggestions that we hope will improve. We are very pleased and very impressed. You're doing well. Thank you.
Thank you so much.
All right, and with that, I will end the presentation unless you have any questions.
I would like to see them in a brighter room because where you were seated, it's not so bright. It looks a bit dull. So I hope on 8th you sit in a location which is brighter so that we can see your face.
Okay, thank you.
Yes.
So that means you will need lighting in your office because it will be, let's see, right now it is 9:37 my time, and what time is it your time? 5:37?
5, yeah, it's after 5 p.m.
So the presentation will be noon my time, so 3 hours later. That means 8 p.m. till 8:20 p.m. So hopefully you will have good lighting.
Oh, wow, it will be at 8 p.m.
8 p.m. your time. Oh my. The world is complicated.
Yeah, with these time zones.
Good. All right. Anything else, President Rukia?
No, nothing much, but we only like to thank you people so much for the additions and for the corrections you have made to us, for the guidance you've given us. We look forward to present on that day.
Okay, and so I think it's 8 p.m. It's whatever I told you before is the time. So
Okay.
it's 11 p.m. Mountain, 11 a.m. Mountain, 12 a.m. 12 noon Central, 1 p.m. and I have to change it to Uganda. So 1 p.m. Eastern to Uganda, is that 9? God knows what it is.
Yeah,
I will send the time again.
7. Yeah, Eastern is like 7 hours behind.
Okay, so 8 p.m. your time. And if you can get online a little bit before that, I know it will eat up your connection time, but so first, before coming online, shut down your cell phone and open it up again so it flushes its memory and you have plenty of memory. Make sure your cell phone's fully charged and have lighting, and inshallah, it will be good. Thank you. All right. Well, with that, we will end. Goodbye, my friends. Thank you.
Bye.
Well done.
Thank you.